What if you think a person is depressed? What do you do? Because depression makes people feel poorly. What do you look for?
It really does. And first of all, I want to make sure that they don't have some organic problem, some thyroid problem or heart, kidney, liver thing that could also be a factor there, because that actually can magnify depression. But if depression seems to be part of why they feel generally poorly, they really have to acknowledge that. And there are medicines to help that, there's counseling to help that, but changes in their lifestyle can really help that too. Better nutrition,
eating right,
sleeping well, very important for many people.
Exercise?
And then physical activities, exercise, and it's maintaining appropriate weight. It's being active every day in some way, and that'll help you sleep better, and it lifts your spirits.
How about laughter in your life? We're almost going through, you've already taken the part we have at the end of the show, which talks about those things. And it's so important with fatigue and with depression. So do most people that come into you, what are the symptoms of depression that somebody has?
Oh, I think for classic depression, people just don't feel like doing anything. They want to sit, they want to sleep, they don't get out and do things with their friends. They're not enjoying general activities, and their mood is low. They just feel poorly.
Is that easy to pick up as a physician? You see lots and lots and lots of patients, and they come in bundles. Mm-hmm. Is it easy to recognize that person that just doesn't feel active?
Sometimes easier than others. Sometimes people don't want to admit that, and they'll put on a good show in the office because they don't want to seem as if they have a problem.
So that takes more detailed history, or can you find depression on physical exam?
Generally not. You're going to find depression in your interaction with someone and their answers to your questions, and you're teasing out what are the things they're doing that are enjoyable. What's important to them in their life. That's really a key to finding out about people, is what makes them tick and what does their world revolve around. And if they can't come up with things that are really important, that's troubling.
A sign that you need to look more carefully at depression. Let's talk about some other medical causes. I include depression as a medical problem, not a weakness, and it's very, very difficult.